The bag mask device consists of a ventilation bag and a face mask, and it comes in a variety of sizes. You can also use supplemental oxygen with the bag mask device. To begin, position yourself directly above the child's head. You'll use the EC clamp technique to hold the mask in place. To do this, place the mask on the child's face, using the bridge of the nose as a guide. Use the thumb and index finger of one hand to make a C to press the edges of the mask to the face. The remaining 3 fingers of your hand should form an E to tilt the head back, lift the jaw, and open the airway. Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and the face. You'll squeeze the bag with your other hand. If the chest does not rise with each breath, then you're not providing adequate breaths. If this occurs, readjust the mask, reposition the head and neck, and attempt to ventilate. And then, only if necessary, administer a larger amount of air. Make sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation, which is air going into the child's stomach instead of the lungs. Gastric inflation can cause vomiting and possible aspiration. If you have multiple rescuers, the most effective way to deliver breaths with a bag mask device is to use the 2-person technique. For this technique, one rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause the chest to rise. The first rescuer will use both hands to seal the mask to the patient's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face. And the 3 remaining fingers of each hand will form an E, lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, because this could push the child's jaw down and block the airway. Another way to deliver breaths is with an advanced airway. Devices such as a laryngeal mask airway, a supraglottic airway device, and an endotracheal tube are advanced airways that are more secure for providing breaths. These devices help prevent gastric distension and airway obstruction. Placing these devices requires special training that we will not cover in this course, but you should know how to give breaths with an advanced airway in place. During CPR, when one of these advanced airways is in place, the ratio of compressions to breaths changes. Instead of giving 30 compressions and 2 breaths, you'll perform continual compressions at a rate of 100 to 120 per minute and target a respiratory rate range of 1 breath every 2 to 3 seconds. There are no pauses in compressions to give breaths when you're using an advanced airway, because these allow blood flow to the heart and brain to remain high.